Good afternoon, everybody. Thanks a million for joining us for today's HPM Lunch and Learn webinar, which will focus on Billink payments, a new online payment integration in your HPM system. My name is Donald O'Neill. I'm the head of marketing for Clonwilliam Health, and with me today I have Andrew Vallely, our business development manager. So the format for today is essentially I'm going to pass it over to Andrew shortly, and he's going to run through a quick overview of Billink in your HPM system, and how it works, how to send billings, and what you'll need to kind of look out for as you start using this. We will take questions at the end after Andrew's kind of run through his demo. So if you do have any questions, what I'd say is on the right hand side of your screen, you'll see a little tab that says questions. If you click the little arrow beside that, it'll let you type in the questions. They'll come to me, and I'll do my best to put as many of them to Andrew as I can at the end of it. So please do ask questions if anything isn't clear, or if you've any queries on any part of the Billink integration. And without further ado, I'll pass it over to Andrew now to start the demo. Andrew, this should be going to you now.
Great, thanks Donald. Hi guys, as Donald said, it's Andrew here from Andrew Vallely. I've spoken to some of you previously, and yeah, a lot of correspondence have been sent out from me, and you have all my contact details. So look, as Donald said, I'm going to run through Billink. I'm going to run through initially just the registration process to show you how to do that. I don't necessarily, I'm not going to do it live. I'm going to show you the screenshots because I've already registered. And then what I'm going to do is I'm going to show you how to add a transaction, to send it, how to receive the payment, and just how it generally works. And also a couple of other areas that are very handy once you're using Billink, that you can follow up on a particular transaction and check its status, etc. I'm also going to kind of fly through the charging, how it works, also the fees involved, and any other information that's needed. And as Donald said, we'll give a couple of minutes at the end for questions if you have them. But certainly feel free to ask the questions at any stage, and Donald then will either come in on what we're doing and answer them, or he'll just give them to us at the end, and I'll be able to go through them with you. So let's get going. So you guys may have noticed when you log into HPM now, you have on the far right side here, you have a new option or a new button. It's Billink. And when you drop down, you have a dashboard and add charge. Initially, when you come in, you have to register for Billink. So this is a very straightforward process and should take around 7 minutes, maybe less, just depending on how quick you can get the info in. But very basically, what you need for this is if you're the primary GP or the only GP in the surgery, or one of the partners, you need to know obviously all of your colleagues' names, and you need your bank account details. If you're the practice manager for the practice, again, you just need to know the partner information and the bank account details for the surgery. So you don't need to, with Billink, change your bank account or register a new bank account or move to a particular provider. You continue using what you've been using up to this point. Your bank account is fine, and you just add that to it. So regardless of how the patient is paying you, card, Visa card, MasterCard, etc., or regardless of what account or what bank they're using, it makes no difference. You can still just plug in your own account details and everything will transfer to that. So when I click on register here, and I'm just going to show you the registering, up will come this window. So you fill in the account name, i.e. the name of the surgery, again, the practice name. So you may want to have it differentiated for some reason, tend not to. Contact name, so who's the primary contact in the surgery, the primary contact email, and then the contact phone number for the practice. It then brings you on to your Billink registration. So in here you would let say your account know whether it's a partnership or a sole trader. If it's a sole trader, you fill in this information, and you only have to fill in the primary GP's details. If it's a partnership, you can add multiple partners. Again, you fill in the practice name, the practice address, the county location, and your area code, and again your practice phone number. And if you have a practice website, click yes, and you can pop that in here at the bottom and register that also. You move on then to your details. So again, whoever you are, if you're the primary GP or whoever you are registering, or if you are a practice manager and you want to put in the primary GP or one of the primary partners information here initially, please do that and fill it in. Again, very straightforward, first name, last name, DOB, and information that's required, email address, phone. And as you move on, you then put in, if you've multiple partners in the practice, you can add the partners. So again, first name, surname, add, first name, surname, add. And then very lastly, you provide your bank account details. And again, we're not going into multiple pages of bank account details. You put in the bank account name, you put in the IBAN, you agree to the terms and conditions, and that's you registered. And immediately, once you're registered, you'll receive information, an email to let you know that you've been registered. But from the minute you're up, you will now be able to begin charging and sending charges to patients. So that's what I'm going to show you next. So let's say we're registered, you want to crack on. You can add charges one of two ways. One is you can open up the patient's file. So if I just open up a patient, I'll open up Yvonne. And when I'm in her file, I can just go Billink up the top here. I can get add charge, or I can go in and view my dashboard. So when I hit add charge, this little window pops up. So what this allows me to do is, if I have multiple partners in the practice, choose who I'm charging on behalf of, if necessary. The patient's name is in here automatically. Her mobile number is pulled from the chart, and also then you can choose the type of consultation. So again, you may have multiple consultation types with the charge already associated. You may just choose to use consultation, or you may want to create a new consultation type that has an online charge, or whatever you may call it. Again, your current list will be displayed and all the charges associated. Now, what you're also able to do is, let's say it's a consultation, but let's say it's a prescription, and let's say it's normally 50 euros, but at this stage, because of the prescription, it's going to be 70. You can write that in, but you can also change the description. So when you're sending this off, you can change and write into the notes section whatever you feel is necessary. Now, I had a query earlier on from one of our colleagues who's on the meeting today, and he had asked what's the maximum you can add in. Currently, the maximum set as to maximum charge is 999 euros. This is just set as a cap by a default cap. But certainly what we can do is, if you need to increase this for any reason to any particular amount, that can be done on an individual basis per practice. So again, it's just a phone call, or let us know in support, and we'll increase that immediately. So I'm going to add a charge of 100 euros here. So again, you can see it's very similar to adding your charges in general. You press submit. So once I press submit, I have the patient's phone number. It now sends a text message to the patient. So you can see here, it goes immediately to my Billink dashboard. The patient now will receive the text message, and I don't mean they'll receive the text message in the next while. In about 3 to 4 seconds, the text message will be delivered to them. So if they're on the phone to you for some reason, or you've just spoken to them about sending them the charge, or they're aware it's coming, they'll literally receive it immediately. Now, normally they'll receive it to their mobile phone, and I'm not going to put my mobile phone up to the camera to show you, but what I am going to do is show you exactly what they see. So when I go down here, I'm going to come back to this area in a second. I'm going to go to transaction, and this just lets me show you exactly how it's displayed. And I'm going to go back in there into that section in a moment, because there's a nice little bit of info in there that's quite handy. So when the patient receives the transaction, the SMS, sorry, this is what they will see up on their phone. So you see here, it's Andrew's practice. When they go to make the payment, when they click the link on their message, the Andrew's practice, I have a picture in the background. You can actually put the picture of your own practice in the background and change that image. You can also change the message. So again, you may want to have a bit more, I don't know, personal or not, but certainly it's a generic message. So hello, please find below the amount due for your consultation and script server provided by Andrew Valley. So you can see that this has all been taken from the information that you just sent on. Here's the charge of 100 euros, and here's a number to contact. This is your phone number for your practice if you have any queries. The patient then pops in their card number. So we can start here, and I'm just going to put in the card number, sorry, too many letters, the expiry date, and then the CCV. Once they have that popped in, they pop in their email address. So apologies, no, that's me. They pop in their email address. Now, the reason they put in their email address is they can then receive the receipt immediately after payment via email. So again, if I pop in my own email address, sorry, there you go, and then agree to the terms and conditions. Once they've done all that and they pay, sorry, my card number is invalid, happens a lot. Apologies. So once you're done, press pay. And sorry, that's gone through, my card number is incomplete. Apologies again.
It's good to show though, Andrew, because in fairness,
Yeah.
the patient, if they're not entering it in right, they get a prompt to say that they haven't done it right and the errors on their side rather than the practice side, you know.
Yeah, again, sorry, this should come through for me now in a second. CCV. I'm just going to put in a lot of ones. Okay,
I think it's actually validating it, Andrew. So it mightn't go through.
that's grand. Well, look, we'll just go. So the guys, then they would press pay, the transaction would go through. And what would happen is, I have a couple here anyway that I've done prior to this. The transaction will go through, and immediately you guys will be able to see on the dashboard that the payment has been made, online payment. And again, immediately isn't in a couple of minutes. Your dashboard will refresh every 10 minutes or 5 minutes or so. But when you come into the dashboard, if you wanted to refresh immediately, you have a synchronize button here in the top right. So you just click that, and it synchronizes immediately. So again, if someone says, yeah, I've just made the payment, you're able to go in here, open it up and say, okay, yeah, there's no fee outstanding, and you can see exactly when the charge is made and exactly then when the payment was made if you click into it, or if you expand it here, and it'll show you the information. Now, I've just sent this, it's 1:15 on a Thursday afternoon. But once you send the text message with the link, the patient can pay that at any stage. So again, they may choose to pay that at 10 o'clock at night. So they may, maybe later or earlier in the morning, but certainly it would all come straight back in. The payment will register, and you'll be able to record it and see the information immediately in your dashboard. Where also will record is in your reports. So your end of day reports, when you go to run them, so go to accounts, and if I go run, sorry, new apologies, and I'll run this is just my report for the end of the day, and I'm going to go back just a year because I don't have much in it. Press run, and when your report runs in HPM, you'll be able to see the transaction, but it was an online payment. So again, you'll be able to see which payments are made online in your end of day report, but also which are cash, credit card, etc. when patients start coming back to the practice on a more full-time basis. You can use this to charge the patient, obviously, if they're not local or they're not sitting in the practice, but also if they're sitting in the waiting room, you can send them a Billink payment if it's easier, or if it's easier for you to do it as opposed to having, say, a card machine active, or having access to it, or if it's down for whatever reason, you can certainly do that at the same time. Now, if I go back in here to my Billink area, apologies, get my dash.
And Andrew, just while you're doing that, a question on that. So you showed there that the patient can receive the receipt, which is great. Obviously, they'll need that for their record. In terms of receipts for the practice, did I see that on a screen you showed there a minute ago as well, or how does that process work?
Yeah, certainly. So you can do it two ways. One is you'll have, once you go into the dashboard, you'll have a receipt of payment in here immediately. So again, if you can see down here, I have invoice or receipt. So I can have
Sure.
that pushed, or I can have that printed out or available at any stage, but also in your end of day reports. So the majority of practices will run a report at the end of day, just with all the different transactions, what has come in. And you'll be able to see that the payments that are there and that they're logged, and the type of payment that they are once that comes in, and it's logged against it. Again, you'll also be able to see what's outstanding.
Sure.
So again, you can see what's paid, but also when you go into your dash, what hasn't been paid, even though you've sent the transaction. And
Sure.
with the Billink Dash, you can go the last 7 days, you can go this month, last 3 months, etc., etc. So again, you're not necessarily kind of restricted to day only, as I have just shown there. You can decide
Right.
what you see. You can see what's been sent, what's expired, what's paid, cancelled, refunded, if you'd like, or all, as I have open there. Also, let's say you've been dealing with the patient and you have sent them the transaction. So you've charged the patient, you know the SMS message has gone, but you want to see the status. So when you go down into the portal area here on the bottom left and you open this, you can see that there's a transaction screen. When I click on that, it loads up your Billink account, but you can see that every transaction is here. And if you click this little button here beside it, it will actually show you that the message has been delivered here in the log area, but also it will show you if the message has been opened and viewed by the patient, and when it has been opened and viewed. So if someone says, I haven't received that, you'll be able to know immediately that they haven't opened it by looking at the log here. So again, somebody may be waiting for the payment to come. You may be speaking to them over the phone. It might be a prescription, etc., that's waiting to be sent. And you can send the SMS. It will be delivered within 3 or 4 seconds. They will immediately receive it, and you'll be able to immediately know if they've opened it, looked at it or not, if they're in the right place. So again, as we know that certain patients may need guidance through this, and it's very, very straightforward on how to do it, and for them to click the link and go through. And just in regard to payment, once they do pay you, or once they put in their credit card information, it's not saved or stored anywhere. it's for the purposes of this payment only. It's not shared with the practice, it's not shared with Billink itself, it's for the purposes of payment, and then that information, once this is closed, is then finished or are no longer required. So every time that they make a payment, it's very secure, it's encrypted, and the information is not shared with anyone else for any other particular reason. Also, I suppose just to flag, there's no sign-up fees. There's no online support or monthly support fees, etc. There is a fee per transaction, and the rate on that is 3.25%. So, for example, if you were to charge a patient 20 euros and the patient pays you, the fee for that would be 65 cents. So again, you could work those out as you go up, but the transaction fee stays the same throughout. The detailed info is quite nice, and it's something that I think will be used quite a bit by people who are using the service and who are able to open it up, view, and you can see. What you do have in here, and the reason I'm going back to it is, for some reason, if there's a payment that needs to be refunded, you can click in here, click refund. There's a reason. You can pop it in just for your own information, and for the patient's information, press submit, and that will then refund that amount back to their account and back to their card. So again, there's not a case where somebody, say, mistakenly pays X, or you charge somebody mistakenly and they make a payment, that you can't refund it the same way that the payment was made. So again, the system is there, and it's a two-way communication as opposed to charge out, payment in, and that's the end of it. Also, you can cancel and increase. So if you go into this area again, if I just come back out and I go down to my portal and I launch it up, what will happen is I can view all of my information here in the portal. I can view pending transfers and transactions. I'll go into that in a bit more detail in a second. But when I go to payments, if for some reason I've incorrectly charged a patient, apologies, if I go to transactions, if for some reason I've incorrectly charged a patient, I can come in here, again, open it up, click this guy here, which is the cancel button, and then submit a cancellation. So again, they may have not have paid you, but you may have sent them a fee incorrectly or a charge, and you can cancel that before anything happens, and that will remove itself, and it will remove any avenue for them to pay it, and it's gone through. Also down here in the portal area, you'll be able to go in and see your payments. So what this is essentially is you'll be able to have a detailed look at any batch payments made to you. So if you're using Billink, patient will pay you, and the transfers, maybe I think it's weekly at the moment, but you can bring that down to daily if required, that the funds are transferred from Billink into your account. And then you can see, as the payments are made to you by Billink, what you got paid on what particular days. So again, if you do it every 7 days, say for instance, it'll be a weekly transfer of X, and you'll be able to go back over time and see exactly what has gone into your account. Also, in the portal area in itself, if I click in here, you can see it says pending transfers. So you may say, right, we normally draw down daily, or we may every 3 days, 2 days, every week, but you can see what's pending. So again, you can see you'll know from your dashboard what payments have been made to you, and you can see what's been pending and what's coming in. So again, you can see all the different balances and anything associated. Again, you can see the picture, and I like to point these out because obviously these are your patients, they know your practice, they know you. So if you have a logo or a picture of the practice, to make this a bit more familiar to them, we can put all of that in there, and all that information can be added in to your account on Billink at any stage. Sorry, no, I'm just going to go through a couple of bits more. To be honest, in general, that's it. You can see that even from when I charge, add charge, choose the patient, submit, 1, 2, 3, 4. The patient will now have the text message. When I go in, then the patient can go in to pay. If it's all going very well, they say pay immediately. So they're in, and I'm just going to show it to you again. They go in, they take the click on the link on the SMS message. And again, I'm not using the actual text message, it'd be too small, just be too awkward for this. But once you go in, they scroll down, they pop in their card number, they pop in their email information, agree to the terms and conditions, and pay. And then in 3, 4, 5 seconds after that, the payment should transfer back into HPM. Or alternatively, if you come in here and press synchronize, it will synchronize everything up. So again, it's up to you guys how you do it. There's no limit on the amount of times that you can press synchronize, or how many times you may use it. I would press it all the time, just so that it's up to date when you come in. But certainly you'll have a full list of all your transactions, and you can break it down by day, week, month, etc., etc. And also, if you want to go into somebody's individual chart, you'll be able to see what they've charged and what they have paid. Donald, have we any questions that have come in, or the guys, anything that's popped up?
None at the moment. So guys, if you do have questions, please do drop them into us, and we'll go through them now. A question for myself, Andrew, in terms of, like, I think it looks excellent, and I think what really impresses me is that it's so easy to sign up for, and you can start sending your billings very quickly. But I suppose, kind of based on what we've seen with people who've signed up to it already, what are they using it for, or what, like, how could this save me time in the practice or make my life easier, I suppose, would be the question I have.
Sure. Yeah. I suppose the main types of consultation or the main types of fees that we've seen are your general consultation fee. So now, people are reluctant to have cash on them, or it's just difficult because it's just in the middle of COVID. And
Yeah.
also, then when they come into the practice, credit card machines coming up to receptions, etc. So what's been happening is that you may have a patient who's due for a consultation. They're sitting outside, or they're sitting in the waiting room in social distancing. You can ping them the charge, and they can pay you then and there. Alternatively, and I suppose this is one of the primary ones, are prescription charges. So again, you may have someone who requests a prescription, and the drug is added, or the drugs are added. You're about to send it off via health mail, but you want to make sure that the prescription fee is paid for prior to sending it. You can then send them on the charge via Billink. They can pay you. You can see immediately that it's been paid, and then you can send off your prescription at the same time. So again, those types of charges, and it's just kind of getting us in a place where you're not, say, sending something off or having a consultation with somebody and having then to lift a phone, get them to call out that their bank account details, keying them into, say, a credit card machine, or vice versa. You writing them down on a post-it or a bit of paper, taking them over the phone. It removes all of that and all the ambiguity in regard to, say, security and what may be happening. Again, some people, you might forget yourselves, and I would on occasion, that if you're calling something out over the phone, you don't know who's listening to you. So it's not necessarily your side taking the details off them, it's them calling it out also that could lead to issues. And again, I
Yes.
suppose those types of transactions, then what it's starting to be used for is historical age debtor transactions. So you may have someone who owes you 50 quid from December. You're able to go into the account, highlight that, and send it off via the SMS, and get the payment that way. Because obviously, I'm not that I'm talking about anyone's particular circumstance, but you have patients say, "Oh, when I come in, or if I can come in at some stage, I'll pay you." But now they can, and all those types of transactions can be sent off, any transaction, all transactions. So again, you can do that, send it off, receive the payment. And I suppose one thing, sorry, Donald, I should have mentioned this, is that Billink in itself will take responsibility for any fraudulent transactions. So again, they will be refunded through Billink if there's ever a circumstance where that arises, and you guys then can communicate directly with that. So it's covered entirely from that point of view. And with there's no monthly charges, there's no card machine, there's no machine down for the day. And as I said, probably most importantly, you can pay at any stage for anything,
Yeah.
and
Yeah.
it will come directly into your software system. So into HPM immediately, job done.
Excellent. Yeah, yeah. So out of HPM immediately and back into HPM immediately.
Yeah,
Sounds great. In
and
fact, we've put a couple of questions in. Sorry, Andrew. We're
sure.
gonna.
No, belt away.
Uh, First one, I know you touched on it, but you might just re-emphasize it again in case anybody missed it. What's the cost per transaction?
Sure. So it's 3.25% of the transaction. So for example, if I go in and I go add charge, and sorry, I will cancel and I'll go back into my patient account. So if I go into Yvonne's here and I go add charge, and I charge, say, Yvonne €50, 3.25% of that is 162. If I again just will go up in the, if it's €100, the charge is again 3.25% of that is 325. If it's 20 quid, it's 65 cent. So again, the transaction fee doesn't waver. It doesn't get higher as you go up. It's not a set fee, 4 quid per transaction, etc., etc. It's based on what you use. So if you decide to put 5 Billink charges through our transactions through in a month, it's 3.25% of that. You don't get charged additional fees if you use it X amount of times or over X amount of times. It's just there to set fee, and there's no penalty if you choose not to use it or continue or cease using it going forward. So once you've it set up, you may decide to use it for all of your transactions. You may decide to use it only for a handful or ones that you think that you need to use it for. It's up to you. There's no rental fee, let's say in inverted commas, or subscription fee to use the service. If you don't have any transactions or use it to charge anyone, there's no fee.
Sure, sure. And another question in that, in terms of the back end of the system, why why do we not need a fintech like Stripe to be the back end of this financial service? So I think my understanding, and you might correct me if I'm wrong, is that Stripe is actually used as the back end of the service, but that the Billink sits on top of Stripe to be the overall kind of messenger brokerage. So you're not just getting the financial service, you're getting the text message to the patient, you're getting the integration with HPM, etc. That's my understanding of it. Now, correct me if I'm wrong, Andrew.
No, you're 100%, and that's exactly what it is. It's Stripe in the background. That's the engine that's driving the transaction part of it. But we needed to have more than just a transaction. One is the SMS message would had to be extremely rapid, and it had to be something that you knew was delivered and it was there immediately. But also the reply had to be there. Secondly, and I suppose most importantly, this is years in the making. You know, people have been asking. It needed to go into HPM. It needed to go into all of our other software systems that it's going to be introduced to, and that's the key to Billink. Is that the kind of the layer on top of Stripe that allows it to be integrated, allows it to be part of the system, but allows it also to be very, very recognizable. And how we do things currently, how we add charges, how we take payments, the structure of it, it's all very recognizable. There's no going outside to add something. You're in my chart. You send me a charge, I pay it. It's all done. It's on my end of day report. Nobody has to key it back in. Nobody has to run the credit card receipt terminals. You know, all of these kind of things. It's done. And I suppose more importantly, and I know like we live in Ireland, nobody has to put a receipt into an envelope with a euro stamp on it and send it off.
Sure. No, that's great. And a couple more questions just coming in. So conscious of time, so we'll fly through
Sure.
these. What's the cost of the actual text message, Andrew? Do you know?
It's 8 cent. If I just go in here, I'll just show you. So if I go into my portal and I click in, so you can just see that the text message is in here. It's just a basic text message that you would send. Sorry, uh, fee per SMS, 8 cent, that you would send through HPM. So again, you send text messages every day for appointments, for different type of alerts, direct text messages to patients. There's no difference. There's an SMS fee. It's in and it runs through the SMS, the current SMS provider you have through HPM. So again, it's all there. It's all linked through, and it just takes it out as you're using them. So again, if you're not sending too many texts, you're not using up or getting charged this fee. But obviously, if I'm sending out a fee for to a patient for €50 and it's an 8 cent text, that's the charge with it. But as I said there in my last comment, like you're not having to post out a receipt or having someone come in and collect it or have a member of staff spending 3 hours out of their day just taking payments over the phone.
And certainly the feedback I've seen from the sites that have been using it already is that they're happy to spend that money because it works so well and it's so easy to use. But just one more question, really conscious we've a minute left. So just at what point in the service is the fee collected from the GP, and how is it collected by HPM? So again, I think this is all done by Billink, and I think you kind of touched on it earlier, but just
Yeah.
when do they pay their fees?
Exactly. Yeah. So again, if you, when the transaction is made, so if you charge the patient that they pay you, you then will your fees will be transferred in by Billink every say 7 days, 3 days, whenever you choose, every day if you choose to your account, and that's when the fees will be applied. So again, there won't be a case where you charge the patient €50 and then you get €50 transferred to your account and then you get a bill from Billink essentially at the end of a month or whatever. Everything is done in real time and on the actual transaction. So as it's done, and then whatever is transferred into your account is the exact amount that has gone in minus the fee.
Excellent, Andrew. Look, that's brilliant, and we've already had some positive feedback in through the questions. So thanks very much, and thanks for the
Good.
demo. Thanks to everyone for attending. I think, look, the key takeaway from this is that it's really easy to sign up, and there's no sort of barrier to you signing up. So sign up, try it out, and I'm sure that given how easy it is to use, it'll be gradually become a daily part of your payment processes, and you'll figure out use cases that the billing guys haven't even thought of. So I kind of hope this was a helpful session. I've learned a lot, Andrew, anyway, and thanks for that. So hopefully
No
everyone
bother
else
at all.
has as well. And
And
look,
guys,
as always, yeah.
sorry, yeah,
Sorry, you
just
were going to
quickly,
say.
yeah, my contact details. Give me a shout if you have any questions. Actually, the one I mentioned earlier on was feedback for one of the attendees about the limit, so that was capped, and that he wanted to extend the limit. And so it's that kind of feedback that will help us grow this.
Excellent. Yeah, sorry. Yeah, that's a really good point, Andrew. And I know both ourselves, as a HPM, and I know the billing team as well, are absolutely dying to hear your feedback. So please do let us know. Yeah, have all our contact details from the emails you send me, or we send you, and that when you sign up to Billink, you'll have their contact details as well. So please do give us feedback if there's things that you would like to see in there, if there's things you think would help you even more. I suppose that the overall goal of this is to make payments as simple and easy as possible for you. So we're absolutely all ears, and we're really willing to work with practices on this to try and make payments easy. That's the goal here, and do it via your HPM system as well. So look, on that note, I think thanks a million everybody for joining us. Hopefully you'll sign up to Billink and start sending your online payments through it soon. Thanks again, Andrew, and we'll leave it there.
Cool. Thanks, guys. Take care.
Cheers. Bye bye.
Bye bye.